I'd just like to acknowledge and pay respects to the past, present and future traditional owners of the land from which we are Zooming this evening. We're Zooming from many lands right across the country, and I pay respect to leaders of Aboriginal clans and tribes all across the country, and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait people. I'd like to pay particular respects to the elders past, present and emerging of the Larrakia Nations, from the country from which I am Zooming from here in Darwin, as well as Megan and Sarah, two of our presenters. I'd also like to pay respects to the Boonwurrung people of the Southeastern Kulin Nations, where our other presenter, Debbie, is Zooming from in Victoria, just out of Melbourne, towards the Mornington Peninsula, I believe. Apologies for the barking dog in the background. Hopefully he won't be too disturbing this evening. My name's Dr. Olivia O'Donoghue. I'm the Medical Director for the Regional Training Hub for Flinders NT in the Top End. For those of you who have watched some of these webinars, you'll know who I am. I'm also a general practitioner living and working in Darwin at the moment, but with a lot of experience working in rural and regional Northern Territory. This webinar series is a collaboration with the Flinders NT Regional Training Hub, Top End Health Services, the specialty colleges and well-respected NT clinicians. As I mentioned, today we're joined by the Royal Australasian College of Medical Administrators, or RACMA, and we have three presenters, and they're going to tell us about the exciting opportunities for careers in medical administration across the country, but in particular the experiences you could have in the Northern Territory training in this field. We have Miss Debbie Greenberger, who's the Director of Member Services and Engagement for the Royal Australasian College of Medical Administrators, Dr. Sarah Watson, who's a Fellow of the College, and Dr. Megan Yanakouros, who's a current trainee of the College. Without further ado, I'm going to stop sharing my screen and I'm going to hand the baton across to Miss Debbie Greenberger, who's going to tell us all the ins and outs and nuts and bolts of a career in medical administration and how you can get onto it. Thank you very much, Debbie.
Thank you, Olivia. I really appreciate that lovely introduction and your introduction of my colleagues, Sarah and Megan, tonight. As indicated, I am the Director of Member Services and Engagement, and the Fellowship Training Program application process sits within my division. Welcome everyone for joining us this evening. I'd like to first start off with a little short video that really captures the heart and soul of what medical administrators are, which is setting the standards in medical leadership for quality healthcare. And it is going to work in a minute. Okay.
These objectives, which were the vision for the college, are just as relevant today as they were 50 years ago. Conceived at a time when the nation's health systems were on the cusp of much needed change. The founders recognised the need to create and support a clearer understanding of the contribution medical administration can deliver for the community to have better health outcomes. They believed in the importance of sharing knowledge, learning and supporting each other, formalising their knowledge into an academic pursuit to provide leadership and advance their profession, with the overriding aim of advancing medicine, health services and systems for the public good. That's why we are all doctors. Doctors who have chosen to join another field of medical specialist. using our medical acumen to make a difference to thousands of lives and improve the nation's health service. Who better than a clinically experienced doctor to understand the complex balance of resources, systems, and finances for the benefit of patients? For 50 years, we've been promoting excellence by creating leaders who are inspired to shape health systems for the better. Leaders who look to the horizon, take on challenges, and truly believe they can make a positive difference to the future. Leaders who are passionate about quality health systems and trained in medical management to provide the best possible patient outcomes with diligence and fairness. We do this by harnessing technologies, research, innovation, scientific advances, and supporting clinicians. Using their skills, fellows of RACMA have shaped health policy to plan for the future, developed leading hospitals and created world-class teaching facilities, set national quality and safety standards, initiated life-saving disaster medical coordination programs, initiated national immunisation schemes, established Indigenous health services, installed large-scale digital health platforms, saved lives of thousands through critical care retrieval, and protected children through abuse reform. Their contributions have been felt from capital cities to remote communities and throughout the world. Healthcare will continue to be increasingly complex and dependent upon teams, systems, and the integration of many complex elements working efficiently together. Its evolution will demand smart thinking, processes, and solutions that deliver the best possible outcomes for all involved, especially for patients. Together, we will shape future healthcare systems for the better.
So I hope you enjoyed that short video that we prepared that was part of our 50-year celebration from 2 years ago. I think it encapsulates quite well the role that we play as medical leaders. So why choose medical administration as a specialty? We are actually one of the 16 specialist medical colleges in Australia. What I find when I do these presentations at career expos, etc., with younger doctors is a lot of people haven't heard about RACMA, and so I'm hoping that today's presentation will certainly change that and provide you all with as much knowledge as you need to make some considered decisions about your career, if not now, later on in the future. We are unique in the world as a provider of medical management and leadership qualifications whose programs are recognised for granting specialist registration, and I'll talk a bit more about that later. Medical leadership provides the opportunity to influence the health of many and shape healthcare systems, and I think that was really highlighted in the video that you just saw. Our training program is about medical leadership education provided by doctors for doctors. As you will see from the bullet points on this screen, there are actually quite a vast range of career options in senior positions that you could find yourself in once completing your medical leadership training and becoming a fellow of the college. These include roles such as chief health officers, chief medical officers, CEOs of hospitals, directors of medical services, roles within education settings, as well as government departments. And you will see through what's been recently going on with the COVID pandemic, the importance of people in those roles in guiding such desperate situations. One of our fellows is actually Jeanette Young, who is the Chief Medical Officer in Queensland, who is, doing a really great job in leading the pandemic response up there. So in relation to pathways and training opportunities with RACMA, we are slightly different to some of the other medical specialty colleges. So I'll outline firstly what our program is about, and then I'll talk you through the application process. So the program is currently a minimum of 3 years full-time in medical administration supervised practice. I say currently, as our program is under review, and we look to having a new program that we will launch in probably 2022. So that timing may change a bit by then. It actually can be undertaken as a part-time study arrangement, and the minimum that you can have in your role in your accredited training post is 0.5 EFT. It's mandatory to complete one of the master's programs in health administration, public health or equivalent, and these are listed on our website for further information. You do not have to be in a registrar role. The training can be undertaken in a substantive position, such as a Deputy Director of Medical Services. If anyone has any questions on those, please, and what that actually means, please feel free to post questions. Once you achieve fellowship, you can then apply to the Medical Board of Australia or the Medical Council of New Zealand for specialist registration as a medical administrator. We are an Australasian college, so we do cross over to New Zealand. Some of our training posts may attract funding, which is specialist training program or integrated rural training program funding. On to the application process for 2021. Our applications are open now. And as I said, it's a three-year full-time equivalent program. There are 4 prerequisites in / eligibility criteria to enter our program. In the first instance, you must hold an undergraduate medical degree. You must have current medical registration in Australia or New Zealand. You must have a minimum of 3 years full-time equivalent clinical experience involving direct patient care. And I say full-time equivalent because sometimes that might take 6 years to achieve the full-time, depending on what you've done leading up to that. And lastly, you must be in an accredited training post or a post that will likely be approved as an accredited training post. That is important. You cannot apply for fellowship unless you have either lined up a position as a registrar, or for those with a lot of senior experience, a substantive post that may be accredited, which generally aligns with people that are applying for recognition of prior learning, which I'll talk about in a moment. Training may be completed in one health setting, depending on the approved accreditation period. And that really does depend on the breadth and depth of exposure you will get as a candidate or trainee during that time, depending on the position. So you would most likely, an example of this would be most likely doing your training in a tertiary public hospital. You will most likely be able to do your training for 3 years in that environment. You may have to look at if there are some gaps, getting exposure to other areas, but generally speaking, you could do your training in a post for that period of time. If you happen to be in a post that was limited in its exposure, one example we have is we have a lot of trainees that are in defence positions, which is quite narrow insofar as, again, comparing the competencies and the curriculum to their job roles. So for example, people in defence will often actually rotate out for periods of time and get exposure in public hospitals or private, etc. So that we work with the candidates to determine what that accreditation period is. To apply, you must apply online via our website in the online application form. And our applications for next year, which the academic year starts in the first week of February 2021, applications close on Friday the 13th of November, if anybody is interested in considering that option. If you need more information, please email our applications team, and I've popped the email address there, which is applications@racma.edu.au. I finally just want to cover off, before I hand over to Sarah, the RPLE process, which is really, there's three components. So within our training program, we have 4 training domains. 3 of those may attract advanced standing or recognition of prior learning or experience. So in particular, the health system science domain relates to the master's component of our training program. So for those who have completed the master's or have done a couple of units prior to entering the RACMA training program, they may apply for advanced standing, meaning obviously they don't have to do it again. With the research training domain, credit may be granted for some previous studies in that area, and there is a process in which you need to go through for that. Finally, which is the area that most people are interested if they have got significant senior management experience, is the domain that relates to the medical management practice. The outcome of this is that an applicant will apply for recognition. They'll go through an interview process. Their experience is reviewed and considered, with the outcome being a reduction in the requirement of supervised practice. So the program is a 3-year program. The outcome may be that there would be a requirement of supervised practice for a 2-year period instead of a 3-year period. And then we nominate through that process the earliest at which a candidate could do their exams. So it is a reduction in time. So in summing up, that is our very brief application process and our eligibility criteria. It's not, there's no interviews required. There might be some people wondering about, you know, the requirement to do rotations. There isn't a set formal rotation required. It relates back to what I said earlier in relation to the accreditation of the training post. And you know, some candidates tend to move about depending on where they're working and what exposure they're getting. So I'd like to thank everyone for listening to my presentation. You can email the college directly at the email address I provided, or please use the opportunity for chat or to post your questions. Thank you.
Thank you very much, Debbie. I was just wondering about the accredited training positions. So if someone started training with RACMA, they could do all of their training in the one place for the whole of training, yep, providing that that position stays accredited? Yeah.
Yes, it is important to note that it generally relates to, for the full period, to a tertiary training hospital, public hospital, because that's where you're getting the breadth and the depth of exposure aligning with our core competencies. Yeah. If you are in a setting that will only provide you a limited amount, there will be an expectation, because otherwise you won't be able to successfully, you know, get through the program and pass your exams, to, you know, get into a role that is going to provide you that exposure. Sometimes it means that a person will stay in their role wherever they are and do short term. You know, it really just depends on the post. So it's sort of on a case-by-case basis, where they might just, so when I was talking about defence, I use that one as an example because with defence, we tend to sort of get them to rotate out either for a 3-month block or a week, you know, that's at a time that will total that period of time to add up to 3 months, because it's providing them with an exposure to the public system that they wouldn't get, you know, during their time in defence. And that can apply to anyone. So maybe another example, I'm just thinking in your area, Olivia, could be a rural health setting. We've got some people that are in those sort of Aboriginal health setting, community setting type arrangements where it would be very limited in the exposure they would get. So they might be able to do their training there for a year, but then they might need to move on to another position to get further experience.
Right, thank you very much. And the other question I had was around if people are working in an area or get a job in administration in a smaller centre or a hospital where there isn't an accredited training position, there is capacity to go through the process of getting that accredited if it meets all the requirements?
Absolutely. I would encourage people to go to our website, and there is a section under education that talks about accrediting training posts. The application form is available there, and it is a requirement of the setting to apply for accreditation, not the candidate.
Excellent. And we just have one question from one of our attendees, John, and he would like to know if an MBA would count towards the required master's component of the training potentially.
Hi, John. Thank you for the question. It is one that we do get a lot. The short answer is no. I would encourage you to go to our website if you are interested and look under the health system science domain, because there are 5 specific units that we require our candidates to do, and MBAs generally don't do that because it's very specific to your training.
Great, thank you. Thank you for that, Debbie. We might hand over to Sarah now to tell us a bit more about her journey into medical administration and experience in the Territory. Thank you, Sarah.
Thanks, Olivia, and thank you, Debbie. And I too would like to pay my respects to the traditional owners of the Larrakia land where we are now, where I am now, and so they're past, present and future leaders in this beautiful Northern Territory. I was reflecting on before I kick off, I was reflecting on some of what Debbie said, and I am very involved in the college, and I found it a I'll just summarize, I found it a very worthwhile career. I am currently the preceptor for, I wasn't very recently the preceptor for 3 trainees in the NT. I have been a director of the college. I'm currently a censor. And Debbie's point about it's up to, which hospitals can be accredited. So for instance, and I know that Megan will talk about this, the Royal Darwin Hospital is accredited, Alice Springs has a trainee, Catherine Hospital until very recently had a trainee. So there are a variety of settings, I'm just listing 3. There's a variety of settings across the NT which are perfectly suitable and frankly give you great experience. So I would always encourage everybody to encourage you to think, no matter what your setting is, it is all doable in the NT. That I think, because there can be a thought in the NT that, oh, I can't possibly do this, I have to go interstate. Whilst that might be advantage to your career in general, I would never say no, because clearly you can tell I'm not here from the NT originally. It is absolutely possible in the NT to get your training done, and I want to encourage people to actually think of that they don't have to move and think of it all themselves. I think that's the most important thing, and we're here to always help. So in terms of me and my journey,
Sarah, sorry to interrupt. I just thought I might ask while we're on that topic still. Do you know of any sort of mixed model or models that have been established with the Aboriginal community controlled health services?
I'm not aware of those. I have to be quite honest, because they haven't come to my attention, but that's not to say that they're not there. And I'd be very interested, Debbie's mentioned those, and I think that's a terrific model here in the NT, because there's one of the things we are very fortunate here in the NT is we have a very close relationship with the Aboriginal controlled sector. So if there are trainees in the Aboriginal controlled sector working out, we would be delighted to include them in, training up in the training programs and how we can collaborate with them. I said, I myself don't have those particular trainees as candidates now, but if they are in the NT, or if they're even in Northern Australia itself, we're very happy, because as I said, I think we're very fortunate here in the NT to have a very close working relationship across those sectors. So
great, thank you.
With that as an answer, I will go back. So why am I here? Why am I in the NT? So as you can tell, I originally trained in the UK. I'm not Australian by birth. I came to Australia in 1990. many years ago, and I worked at the Alfred, and that's where I first got my first flavour, if you like, of medical administration at the Royal Prince Alfred in Sydney. Sorry, the Royal Prince Alfred in Sydney. And that's when medical administration first came into my ambit, that there was a role for, in terms of management, in terms of decision making, in terms of widespread planning, that you could do. You didn't have to wait till you were 70 and almost at retirement of a senior doctor. It's actually a career that is available to you to take through as a well-respected, credible, and as Debbie was saying, a very senior career. And that was new to me when I arrived here. And I think Australia has done a terrific job in establishing this as a great career path. I really do. So I came up, as I said, I was first exposed to this when I arrived in Sydney many years ago now. And I obtained my fellowship in 1997, so many years ago now, more than I care to think, and I've been in senior management roles ever since then. So it is a terrific opportunity, as I said, for senior management roles, for a really broad breadth of training and experience, and I'll come to that. So so my path, let's say from 1997, so from 2000, I was in Melbourne as the deputy DMS at the Alfred. I then went to Caulfield as the Director of Medical Services. I went to Peninsula Health, and I did many years of operational roles, in fact. And so working in senior, I was the Executive Director of Acute Services, and I was the Executive Director of Subacute Services. So what I'm trying to say to you is that the breadth of the roles here are not merely DMS roles, they span the entirety of management, of management roles. I arrived in the NT in 2010. My family and I moved up, and it was then that I actually took up my first full DMS role, and I became Director of Medical Services at the Royal Darwin, which is the largest hospital in the NT. For those of you who haven't ever been here, there's 380 beds. It is an extremely busy hospital. It is the only hospital for thousands of kilometres around. So it takes patients from Southeast Asia, we take patients from Western Australia. It is a very, very busy hospital, far busier than probably the population would lead you to think. So, and I can go into that later, but essentially it's a very, very busy hospital. And I became Director of Medical Services there in 2010. And I did that role as the hospital expanded from a hospital to the centre of a health service. I did that role for 6.5 years. And so I was the DMS, and then I became the executive DMS of the entirety of the health service. In fact, when I was looking at Debbie's PowerPoint of all the roles you can do, I was thinking, well, I've done an awful lot of those. And so in 2016, I came into the health department, which is where I am now. And I'm currently the acting chief medical officer of NT Health. And as part of that, I'm the senior director of clinical excellence and patient safety. I am also supporting Top End Health Service, so I have a role there. And I also have a large role, which is a really fascinating role as the chair of the NT Child Death Review Committee. So I guess the point I'm making by laying all that out is this is an extremely diverse specialty, and it can lead you very quickly into senior management if that's what you want to do, and if that's where you want to take it. I've been able to expand it into a very, very strong role in clinical governance. As I said, I'm also now working in different agencies to support, as I said, child death reviews and child safety. So I have found this career fascinating from start to finish, and hopefully there are plenty of years left. So that's me. And in terms of what attracted me to work in the NT, my family moved up. So I can't honestly say it's a conscious decision to move up. What has kept us here, which I think is far more important, is we love the NT. We love the climate. We love the really strong Aboriginal culture, which just pervades the NT and is part and parcel of living here. And we love that environment. We love the bush. We love the remoteness. And when the borders are open again, we love the fact it's only an hour and a half off to Bali. So, you know, there's lots of places you can go, which in southern Australia are just thousands and thousands and thousands of kilometres away, and here are very, very easy to reach. Singapore's 4 hours, Bali's an hour and a half. There are so many opportunities here, and so that's why we have stayed. All right, schools are great. We're really happy. The house is great. We're very happy here, and so that's why we have stayed. All right, so it's not so much why did we come up. People come up here for all sorts of reasons. The more important thing is what makes you stay here. All right. In terms, as I said, I've set out what I do. I have a very busy role. As I said, really, I think one of the advantages of this specialty is you can do as little or as much as you want. Clearly, you can stay in a hospital and do the DMS work. You can do broader work. You can do health services planning, like I'm doing now. Much broader work. It's entirely up to you and your interests and where you want to take it. It lends itself to research. So we are starting to look at safety science and safety systems research. There's so many different aspects here. In terms of my longer term goals, well, my personal longer term goals are to keep employed. I think that would be for everyone at the moment. But also I think to keep being engaged. I think particularly throughout your career, it is so important to be engaged. And what is so good about working in the territory is, and I think we were talking to Olivia about the relationship with the Aboriginal Medical Services, you are here for the patient. Everyone who works in the NT health system is here for the patient. That is absolutely clear. Everyone knows there are challenges in the NT health system. That is absolutely correct. But there are massive opportunities. There is so much to be gained. There is so much to be done. There is so much enjoyment to be got out of the work here. So that's my longer term goal. In terms of my professional goal, then clearly, as I said, one of my key roles is clinical excellence, clinical governance across NT health. And that is obviously my professional goal in terms of really raising that up. So we have a service that we are really, really proud of. We are certainly getting there, but as I said, there's always work to be done there. What else do I have to do? The challenges and advantages. I think, being honest, I think the college is a small college, and so you are not going to be surrounded by 20 trainees and 20 fellows and all the rest of it. So that is a challenge. But I think if there's one thing that COVID has done, it is showing you that remoteness is only a telehealth away, is only a video conference away. And I think I can see that getting managed a lot better in the future. There are certainly quite a number of trainees coming through the NT now. The college is still small. I can't get away from that. But I think increasingly the college is establishing very good, strong links in training through Queensland and what have you. And then I think Megan will talk about that more. In terms of the opportunities, I think I've spoken about those, that the value of having this qualification, it does expose you to so many specialties, to so many possibilities here in the NT. All right. I think my last question, I'm happy to answer questions, but my last sort of dot point issue, who are the key people or the networks that can be contacted? I'm always happy to be contacted about training and what are the options and have you. I'm always happy to do that. And of course, RAPMA itself is always a really helpful resource in terms of seeking advice and giving out information. So with that, I've given a very brief summary, but I'm very happy to answer questions.
Thank you very much, Sarah. It sounds like we're very lucky in the Territory to have your wide breadth of experience and all the work that you've done overseas and interstate as well, all culminating in a very important position with Department of Health. So thank you very much. I was reflecting on all the things that Debbie had mentioned in her presentation about all the different opportunities and different places that you can work and end up or travel through to get experience, and you've definitely highlighted
I think
all
I
of those
encompass quite a few of those.
and cemented them a lot for me. I did wonder where you were getting in an hour and a half, and then thought about the overseas connections. So I might hand over to Megan now, just in the interest of time, and we might come back for some questions afterwards. Thank you, Megan.
Oh,
Thanks.
Hi everyone, I'm Megan. So a little bit about my journey, I suppose, is that how did I get here? So I came to the Northern Territory in 2001, and I worked for the Education Department, and I worked in a remote school in Oampelly for a couple of years, and I was the office lady basically, so I was their business manager for 2 years, and then I moved to Oampelly straight from Adelaide, so that was a little bit of probably a culture shock. You could probably describe it as that, but it was a marvellous experience, and I learnt an extraordinary amount from some very incredible educators in Oampelly. And after 2 years, I moved to Darwin, and I started working at the Royal Darwin Hospital, and I worked in sort of operational administrative roles, I suppose you could say, while I studied nursing. So I had half of another degree, I will admit this, from Flinders, where I'd done 4 or 5 years of a biomedical engineering degree, and then decided to be a terrible engineer, so I never became one. And so I converted my half a science degree to a full science degree with CDU, and I became a nurse at the same time. So I worked for a couple of years in the Royal Darwin Hospital as a nurse, and I worked for the IT department. And then I had a family, so I had 3 children in 2.5 years. And during that time, I moved back to Adelaide. And when I was in Adelaide, I lived in a small country town about 70 k's from Adelaide. Doesn't sound like the country really, but I worked for the doctor's surgery. So I worked for the general practice there. It was quite a large general practice, and our doctors worked on call. So I worked and I managed all their clinical care coordination for that doctor's surgery. And while I was there, I decided to go to medical school. It was, some thought of it as a reasonably questionable decision, because at the time I started medical school, I had a 2, 3 and a 4-year-old. So I drove every day from my country town to Flinders in Adelaide, and I started medical school. And I did 3 years in Adelaide, and when we were getting towards the end of my medical degree, my husband and I decided that we would move back to Darwin, partly because we thought it would be better for the children, and I'd worked in this hospital before, and I had an opportunity to go to Gove and to Alice Springs in my final year of medical school. So we packed up our 3 children and we went to Gove, and again people thought that was a reasonably questionable decision, and my girls loved it. So we did 3 months in Gove, 3 months in Alice, and then I finished medical school in Darwin. I've done all of my junior medical officer training here in Darwin. I've been an intern, a resident. I worked as a medical registrar for a year in 2017, and I became I was one of the first registrar trainees in medical administration as a PGY4. And so I'm in my 3rd year of medical administration training, and I am due to sit my exam in December and finish, and I'll finish my master's degree partway through 2021. So my children are slightly more grown up. The youngest will start high school in 2021. That's goodness gracious. I'm sure the high school's looking forward to that. So that's how I got here. So I suppose, why did I do this job? I think when I was a medical registrar, I had a volunteer role with the Top End Medical Society, which is the RMO Society in Darwin, and I used to do quite a lot of work about rostering and junior doctor health and wellbeing. And someone asked me to apply for the job, and I think potentially at the time I saw it as an opportunity to improve my work-life balance. because I'd worked 3 years in full-time shift work, which was reasonably challenging with 3 little girls. So I was privileged enough to be offered a job, and I took it, and I'm still here. So I suppose, you know, what do I do? I've sort of done many different things in my time. I mainly work in the medical services area of the Royal Darwin Hospital, but I do other work for people as opportunities arise. So I've done some work for Sarah in the Department of Health with safety and quality, and I still have quite a lot of involvement with safety and quality projects with the Royal Darwin Hospital. I do a lot of work in recruitment especially of junior doctors, and I still have some involvement in rostering. I have a rare combination of skills apparently, in that I actually understand our rostering system, because that's where I used to work a very long time ago, and we still use the same rostering system 15 years later, and I still know how to use it, even it's manifested a few times. And so the next thing is what attracted me to work in the Northern Territory. I sort of, like many people, I came here by accident. When I first went to Onpelli, I left Adelaide and I said I was coming for a year, and I was still here 7 years later with 2 children and a third on the way. And at that point I did go back to Adelaide for 5 years, as I said, but when I came towards the end of medical school, I went, oh, I actually really wanted to come back and work here again. I think the clinical complexity here is extraordinary, and you don't really see anything like this anywhere else. But I do always say to people, I think the thing is, I don't really have anything to compare it to, because this is the only hospital I've worked. As a nurse and as a doctor, I've worked for general practice, but I've been a medical student at Flinders Medical Centre in Adelaide, but I haven't worked in another hospital. So my comparison point is limited, which has its advantages and disadvantages, I suppose. I've been in Gove and Alice Springs as a medical student, but I haven't been back as a doctor. I would love to go back, because I think they're both quite extraordinary places with different challenges and different opportunities, I suppose, and they're all very welcomed. I suppose what my longer term goals are, I suppose my shorter term goals are to finish, hopefully by the middle of next year, and finish my specialist training. Where to from there? I suppose there's, as you can see, there's many opportunities that the future may hold. And I think in the longer term, I've now lived in the Northern Territory for, probably 14 years out of the last 18, and it's our home, and my children have grown up mostly here, and it's their home as well. And so I suppose, to contribute to medical service delivery in the Northern Territory with all the complexities that brings, but bringing sort of, experience and skills in medical administration to that service delivery. I suppose, everything does always come with its challenges. So I was the only registrar trainee in the Northern Territory, but I have got many offers of help from many other states. Everyone tries to adopt me. They kind of think that I share a border with multiple states, so I should belong to various forms: Queensland, South Australia, Western Australia. Sydney-siders have tried to adopt me as well. So basically everyone tries to adopt me, which is lovely. I do come under the care of Queensland in terms of jurisdictional training, but everyone, and as Sarah said, I think with the one thing about pandemic is the fact that distance isn't so great anymore, because Zoom is much more normal and much more accessible. I have sat on teleconferences with the Queensland Training Network since my first year. And And so, but I've also travelled a lot to go to various sort of meetings and workshops and the like, and obviously that's been a little bit problematic this year. But most of that service delivery has been done, you know, remotely, which has been fabulous for someone like me. So do I feel lonely? Not really. You know, I've got so many offers of colleagues offering to help and guide, which has been really quite lovely. I suppose the advantages are exactly that I've gotten very many offers of help, and I'm not that lonely at all. And, you know, I do have this privilege of working in this very unique place with, you know, extraordinary complexity that, you know, is probably difficult to recreate anywhere else, even if we tried. You know, so I've spent most of my working life in health in this hospital, so it's a very familiar place to me. I'm quite fond of it most of the time. I think that the advantages and the disadvantages to some extent cancel each other out. And I suppose contacts is, I'm also very happy to be contacted, and obviously RACMA is a contact. I have lots of, I talk to junior doctors on a daily basis about very many things, and I talk to multiple other people, so I'm always happy to talk about the position and the training program and the opportunities that it may bring.
Great, thank you very much, Megan. That is a very exciting journey. Quite interesting to hear all of the motivations from changing from one career pathway to another. And I don't think you have to be ashamed or conscious of doing that, because it's all those experiences have made you the well-rounded person that you are now, and your passion for medical administration, safety and quality really comes out in what you're saying and supporting your peers. I'm glad that there's a huge support system for you and that you've been adopted into many other administrators, but I hope they don't try and poach you from us, because it sounds like we need more of you in the Northern Territory. We need to multiply you rather than lose you to other people. I was interested in what your master's was, and I'm sure some other people might be interested in that as well.
So I'm studying a master's in health management through the University of New South Wales, which is completely online, it's like they don't have a lot of face-to-face delivery, which suits me. I think that there's a lot of different options of master's degrees that RACMA recognises, and I think it's a personal choice. Some people prefer face-to-face delivery. I've actually never preferred that. I actually prefer online learning. I did my whole nursing degree online through CDU, and with the face-to-face delivery. But I think everyone has a preference, and I think that it's a matter of researching the degrees that RACMA recognises and then finding the right one for you. This one works for me, but I think that it is a personal choice. And, you know, there's certain requirements that the university has to meet core units for them, but also RACMA has a series of core units as well. So you just have to line both of them up and make sure it all adds up in the end. But I think there are multiple degrees that are all listed on the RACMA website that you can research and find the one that you think will work for you.
Good. And talk to the people around you that are doing particular master's degrees and stuff as well to work out what they're doing. We recently hosted a webinar in our JMO forum space with rural and regional generalists who've been working overseas, in particularly East Timor, the Solomons and PNG, and every single one of them reflected on going to somewhere that doesn't have as much administrative support and system support, that they had to step up into that space very quickly, and very quickly began to appreciate the core necessity of having good administration, and being able to put in good systems and get safety and quality protocols and leadership in that space. And I imagine that they were missing, what sounded like they were very much missing, having administrators, which some of them reflected when they were working in Australia. They often resented to some degree because of being a worker bee, I guess, within the systems, and not necessarily being happy about things, but they quickly changed their minds about that. So it's definitely a very, very important part of the medical careers bucket, I guess, and I'm glad we're doing our part to be able to introduce careers in RACMA to our medical students and our junior medical officers. Is there anything else that anyone would like to add before we finish this evening? No, wonderful. Well, I thank you so much for coming along and participating in the Flinders NT Regional Training Hub Careers Pathways. Hopefully we will get to see you all in the future in person with our face-to-face careers expos that we usually have annually, and these webinars have come because of the COVID situation, I guess, across the country. So I've just shared my screen, and hopefully you can see the Regional Training Hub contacts there. I'm just going to launch a quick poll for our attendees to quickly answer just those few questions about the webinar this evening, to give some feedback to the Regional Training Hub. And again, just one more formal thank you to Debbie, Sarah, and Megan for telling us. Debbie or Abdul?
Yeah, sorry, the Zoom just crashed right at the end. So I will try and end it again now.
Thank you.